What's up, guys? All right, Dr. Chris Park here. Today, let's talk about a couple of different patient types that might be taking medication assistance. The first is a friend of mine who has chronic pain issues. He had actually been in the past, like years ago, he had trouble with pain medication. He was overtaking, so he got on Suboxone. And then came off of that, and lately he's been just taking well, I won't say lately, but then he basically kind of got back into like a pain management scenario, but he wasn't taking pain pills every day. He was just kind of taking them as needed here and there. But he started having increased pain. He started to increase his use. He then had access to more pain medicines that were not his prescription. He had this access to this came in. Then on top of that, he had a huge life stress, like a traumatic event happened to him. And through the trauma, through the depression, through the grief, he relapsed, right? And started using opiates heavily again. And he's to that point where he knows that if he doesn't make a change, he is going to be in a very bad place. And he doesn't want to go there again. So he is a very good candidate to get back on medication assistance with something like buprenorphine, right? Because that will help block his cravings, help block his withdrawal, and will also help with some of the pain issues he's having. And then possibly with time, he might be able to taper off, or because of his chronic pain issues, he may need to just stay on treatment for an extended period of time. The other patient that I encountered was a younger patient who has been abusing Roxy's and fentanyl, and again has come to a decision that he's got a very good, strong, personal relationship that is helping him change and make good decisions and positive decisions, right? And so with that, we're going to use medication assistance because he's tried stopping on his own. He can't. He also can't afford any kind of inpatient rehab or stronger, type detox situation. So we're going to use medication assistance to get him off of the opiates to kind of help prevent overdose and death, and will then allow him to continue to work on this relationship, which is actually a very positive influence in his life, and then he can kind of continue to make positive changes and get away from the dealer, get away from his friends who are using, and get away from that lifestyle. And I told him that with addiction, it's common because we have this idea that, okay, if you're an addict, you have to say, okay, I'm so-and-so and I'm an addict. But my goal is always, and you need that, you need to, have that kind of self-honesty. But my goal is to eventually have my patients in a position that they're so far away from that lifestyle, that they don't identify themselves that way. Now, that doesn't mean you're living a delusion. It doesn't mean that you can just, say, oh, well, I can do whatever I want. No. But what I want is for people to just be completely in a different place in their life, so that it would be very, strange and bizarre to go back there, right? Because if you've never smoked a cigarette before, and somebody offers you a cigarette, you're probably not going to be that tempted to. You don't see yourself as a smoker. You don't identify that way. You don't think that way. And so it's kind of similar. Like, my goal is for you not to identify yourself that way, so that you're not even that tempted anymore. It doesn't mean all the cravings are gone. And it also doesn't mean that if you're not to that place yet, you can't be, tapering your medicine or doing something else. I don't want people dependent on a pharmaceutical drug to live a normal life. But it can be helpful for certain people in certain situations for certain periods of their life, And I think those were two good examples of people that this medication can be helpful for. And more than likely you guys are in or have some type of similar story to these, and you kind of understand that. And you can kind of take where you're at now and where are you on this road to recovery, and you can just kind of continue to make good, positive changes to push yourself down the road to recovery. And that doesn't mean you have to stop everything or do this or that, like stop medicines is what I'm saying. You do need to stop the drugs, right? But it just means that you can be going down the road in a positive way, making good changes and getting to a better place. And every day that you're clean, you're that much closer. You know what I mean? But it's not like there's ever, life. I mean, I don't want to be a cliche like life's a journey, but like it's not like you've got this goal line that you're going to hit one day. It's more like you're just going to keep making these steps forward, and you're going to look back and see how far you've come. All right, guys. I hope that was helpful. Y'all have a great day. Do something positive. Peace.